you may have heard this before, but you should never dispose of your medications by flushing them down the toilet or putting them down the sink. That is not the thing to do. And here to educate us about this really important topic is Sarah Cooper with the Tennessee Department of Mental Health and Substance Abuse Services. Good to have you here.
Thank you.
And next to her, Kathy Glapa with the Tennessee Department of Environment and Conservation to talk about prescription drug take-back boxes. And pretty self-explanatory, but you're here to explain a little bit more to us and tell us why we need to have these instead of just tossing them in the trash.
Sure, they're very important. We have an epidemic of opioids, especially in this country. And so we really worked with the DEA and other agencies to develop specialized locked boxes that are housed in secure locations where people can either return their prescriptions or drop off their prescriptions that maybe they aren't using anymore or that they have expired. And really the purpose is twofold. It's to keep them out of the streams and in our water system, but also keep them out of the hands of people who may misuse them.
Because that's a real problem, isn't it, with people that have a problem, an addiction to these prescription drugs, which is so prevalent, unfortunately, that if people are working in your home, or I've heard in open houses, sometimes this happens when people are showing their home that people may go through looking for prescription drugs. Is that the case?
I think so. The biggest thing is there's health, safety, and the environment. There's a trifecta that we're trying to protect, and the take back boxes, like Sarah was saying, are located in law enforcement, pharmacies, and they're under surveillance. So it's a safe place to take your expired or unused medications to, so people can feel safe about disposing of them properly.
I was going to say, why is it so important to properly dispose of them? I mean, for the environment is one.
For the environment side, you don't want to put them in the trash because people can go digging through your trash, so that's the safety side also. And when it goes to the landfill, it could eventually end up in our water through leaching through the system in the landfill. And then flushing, you just don't want to flush because it's really hard for the water treatment plants to treat those types of things. Our body excretes it naturally when we take medicine, and they're having to treat those as well. So
when it's not filtered out by the body is what you're saying, the water treatment plants,
it's harder.
They just don't, it's more difficult to know how to deal with it.
There's a really interesting and I think very profound statistic out there that says that 52% of the drugs that are misused by youth age 12 and up are actually received by a friend, a family member, bought or sold, through that, compared to 4.9% that are actually sold on and bought on the street. So the majority of the prescription opioids specifically that are out there that are being transmitted back and forth and misused are actually coming from legal prescriptions that people have, that they're sharing, that they're having stolen from their house, that are just sitting around, and you have you get prescribed, 30 days worth of Percocets, you take 2 or 3 of them and you put them in the cabinet, and that's unfortunately how they end up in the hands of kids. And
what types of medications can you dispose of in the boxes then? You're talking about opioids, or can it be anything?
Tylenol, acetaminophen, vitamins, ointments, pet medications. Sometimes you don't use all of your pet medications, so those are some of the items that you can take to the drop boxes. So over the counter and prescribed as well.
Lotions or drops, I see that on the list. So even eye drops, liquid medications in leak-proof containers.
Correct.
So you want these things sealed up,
yes,
if at all possible, or they have to be. And how can you safely dispose of medication at home? Let's say you can't get to one of these sites. How can you do it at home? Is there a way to do it properly? I know you'd rather them bring them to the boxes, but is there a way?
There are some pharmacies carry, and we're actually working on an initiative through some of our anti-drug coalitions throughout the state to bring in bags that you would receive with your prescription. So say if you got a prescription and you were not going to complete the whole thing, you could actually mail it. It's a pre-labeled bag where you could put it in, and it's mailed back, and the pharmacy itself is responsible for disposing, which is separate from the
Okay.
DEA initiative. But it's another option.
Where can you find these take-back boxes? You mentioned earlier police stations.
So there's one in every single county in the state of Tennessee. All 95 counties have at least one or more, and they're typically at a sheriff's or a police department.
All right. Okay, and is pretty visible, pretty easy to find.
They're the size of a mailbox. Like if you were to go to the post office and the big mailboxes, they're that size. They're large.
All right.
So you wouldn't miss them.
That's good. Have people been pretty compliant doing this, or not compliant, but have you had a lot of participation, I should say?
70,000?
Since we've been collecting the numbers in 2012, it's over 240,000 pounds collected.
Incredible.
And this year so far we're at 76,000 pounds, and we have 2 more months to go. So we'll reach 100,000 in 2017, which is good and bad.
Saving lives and saving the environment both.
Yes.
And if you or someone you know has a prescription drug problem, addiction, where do you turn for help?
Absolutely. I would encourage anybody who has an opioid addiction, especially alcohol, call the red line. Hopefully the number's on the screen, I believe.
It is. It's right there under us. Okay.
889-8789.
Great.
Yes, please. It's a 24-hour referral line. Great resource and lots of opportunities to recover.
Thanks so much, Sarah and Kathy, for coming
Thank you.
in. Thank you. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.